Hi everyone, in this video we'll be talking about posterior onlay case selection. Just before we get started, we'd like to thank Dr. Kushal Gadhia, who is a consultant in restorative dentistry and a specialist in periodontology, prosthodontics, endodontics, restorative dentistry, and has a special interest in dental implantology.
Dr. Gadhia has been kind enough to provide the content from ACE courses, and while this video is a summary, the full webinar is available to students completely free of charge on the ACE courses website. Sign up link is in the description.
The indications for an onlay are as follows. You can use onlays to electively restore heavily restored teeth, or teeth with a developmental defect like amelogenesis or dentinogenesis imperfecta. You can also use onlays when teeth are carious, have a crack or a fracture, when they've lost a lot of tooth tissue after doing a root canal treatment, for example, or even when there's a lot of tooth surface loss. With any of these indications, the aim of providing an onlay is to strengthen the tooth and improve its prognosis.
When looking for a suitable candidate for an onlay, you need to consider the presentation of the tooth in question, the patient themselves, and the material choices available to you. However, it's important to explain to the patient that whatever you do, no restoration is permanent, but instead you are just trying to delay the inevitable failure. For example, placing an onlay on a cracked tooth won't stop the propagation of the crack, but instead it will just slow down the rate at which it propagates and buy the tooth a bit of time.
In terms of presentation, you need to see if it's a premolar or a molar and whether it's a virgin tooth or if it's restored. We also need to consider if the functional or non-functional cusp is compromised, and you can use the Pobble rule where the palatal cusps are the functional cusps in the upper arch and the buccal cusps are the functional cusps in the lower arch. The opposite is true if the patient has a crossbite, and in this case you can use the Bull rule.
We also need to consider the forces that will be placed on these teeth and the patient's occlusion, but this needs an entire video dedicated for itself and we'll be releasing one soon. If you can't wait for the summary and you're a student, then make sure to head over to the Student ACE Courses website where you can sign up for free to watch those webinars. In the previous video of the series, we've covered how root-treated teeth affect the need for cuspal coverage right after obturating, so feel free to watch that video as well for more information.
The final thing to consider when a tooth presents to you is the amount of tooth tissue that remains, and more importantly, how much dentine would be left after you prepare the tooth for a particular type of restoration. This should be visualized in your head before taking a burr to tooth tissue, and if there's a sufficient amount of tooth structure left, then that particular design for an onlay would be acceptable. Also, in terms of coronal tooth structure, we must look at the isthmus for an MOD restoration. If there's less than a third of tooth tissue lost between the buccal and the palatal cusps, then it's argued that cuspal coverage wouldn't be needed.
However, we know that we often get heavy forces occluding where the ridges are, and so if these are lost, we may need to increase the strength with cuspal coverage. We also need to assess how much height would be remaining after the preparation. And we know that the ferrule should be a minimum of 1.5 millimeters to 2 millimeters all the way around the tooth, especially interproximally and on the functional aspects. Finally, you should check that you have a good attachment around the tooth so that you won't invade the biological width.
All of these factors will help you decide on the material you want to use to fabricate this onlay, and even if it's possible. Once you've thought about the presenting tooth, you need to think about the patient's aesthetic concerns, their age, medical history, consenting process, and whether they have a parafunctional habit. For example, if a patient had canine guidance and a steep disclusion and no involvement of the premolar that you're trying to restore, and it had an MOD restoration, the more conservative option is to replace the MOD with a composite restoration, and it should be of good prognosis and delay that restorative cycle. On the other hand, if a patient occluded in group function and had a parafunctional habit, of course it would be better to restore this premolar with cuspal coverage.
Before you start anything, you also need to make a decision about whether you'll be doing a conventional or an adhesive restoration and the material you'd like to use to restore the tooth. If you chose the conventional route, your material choices are between gold and Emax. And if you chose an adhesive restoration, your choices are between composite, Emax, and gold. You make this decision based on a number of factors.
If you opt for a conventional onlay, your margins are allowed to be subgingival because there isn't that same need for moisture control. You'll also need to have good retention and resistance form and an adequate prep height and a 6-degree taper ideally. However, while the preparation might be more difficult for conventional onlays, the cementation is really quick and easy.
If you opt for an adhesive material, you won't need the same retention and resistance persistent form, and the margins have to be equigingival or supragingival, and there needs to be 90% of the enamel still remaining so that you can properly bond the restoration to the tooth. We should also be aiming to create rounded and smooth margin preparations to prevent stress points from sharp edges, which could lead to crack propagation. In this case, while the prep will be easier, the bonding will be much harder and time consuming, and a rubber dam is always necessary during the bonding procedure.
Okay guys, we hope you found that video useful, and if you did, we'd really appreciate it if you guys like the video and subscribe to our channel. There are more videos like this coming soon in line with the ACE Courses webinars created by Dr. Gadhia.
For the full webinar, make sure you check out the ACE Courses website, which is completely free for students to use. It has lots of webinars covering occlusion, tooth surface loss, perio, and so much more. There's a link in the description to sign up if you haven't done so already, and we'll see you guys in the next video. Thank you for watching.
Thank you.